I want to thank the senator from Nebraska for offering this amendment. Obviously, it's been offered before, but every time I go home, it renews my energy to try to stop this from taking effect. The small business people are approaching me and saying, this is just crazy to have to report every trip to the Office Depot, to have to report every travel voucher for $600 because I'm going to a meeting in California. It defies description except to say that it's one more overbearing government intrusion on free enterprise in our country. So I hope very much that because of the message of the elections in November, that more people will see that this is not necessary. It's certainly not a part of healthcare reform. In fact, when I saw this come out, that there was this little provision tucked in the enormous healthcare reform bill, my thought was two things. One is that they are paying for this enormous cost of the government takeover of healthcare on the backs of small business people in our country. That would be one interpretation. And the other would be that all the talk coming out of Washington about new taxes and possibly a value-added tax, that maybe they're starting to want to get the reports that would be the basis of a new tax system, neither of which should be part of healthcare reform in this country. So I am hopeful that we can put this to a stop right now. I think the people of America well understand the burdens that this healthcare reform bill that was passed Christmas Eve of last year over our objections on this side of the aisle, that maybe we can start peeling away some of the most onerous provisions, and particularly this one, which takes effect in 2012, to at least begin to let people know that we are going to try to mitigate the damage that this health care bill has done. And we are going to do it a little bit at a time until we can repeal the whole thing and start all over. It's not that our system doesn't need reform. We all have said it needs health care reform. But having to report a trip to the Office Depot to buy stationery or a fax machine is not the way to a better healthcare system. It's a non sequitur. So I hope that, Senator Johans, that your bill passes, that your amendment to this bill passes. It's a freestanding bill, but it's a great amendment to this bill. If we can stop this now, that will be one thing that we can take off the table as we are addressing the major issues that actually do deal with healthcare reform. And maybe we can bring it down to a level that we would be able to address it in a more responsible way. So I thank you. In fact, I will just say that even the National Taxpayer Advocate Division of the IRS has said that they would have significant challenges in processing and analyzing the enormous volume if this piece of the Healthcare Reform Act goes through. Even the IRS is saying, how could we do it? Which then would lead to what? More employees at the IRS. Well, that should scare the people of America. The last thing we need is a bigger government created to try to go into the small businesses and see if they are complying with a $600 requirement for every transaction that they would take. So I commend the senator from Nebraska for offering this amendment. I'm a co-sponsor of this amendment, and I hope that we will have enough votes to stop this provision in its tracks, take it off the table, and then deal with healthcare reform on issues that actually affect healthcare reform, not issues like this that just burden small business in our country at a time when we want them to hire people. We want them to open their doors. But the more restrictions and the more burdensome paperwork we put on them, the less chance there is that they're going to hire people. And that's what I'm hearing from my constituents, and I know it is the same for all of us who have been home listening to what the people are saying. Thank you, Mr. President, and I yield the floor.
Mr. President, may I inquire how